Today, the Supreme Court heard arguments in a case that could strike down the Affordable Care Act in its entirety. If the Supreme Court agrees with the opponents of the act, their decision could take health care away from 20 million Americans. It could take away protections from more than 100 million people with pre-existing conditions in our country and hurt the millions of Americans who have come to rely on the Affordable Care Act. Getting rid of the Affordable Care Act will take us backward to a time when people could charge a woman more for her health care than they could charge a man, simply because she's a woman. To a time when pregnancy could be considered a pre-existing condition. It will take away free birth control and contraceptive coverage for women. This is all happening at a moment when our country is suffering through a pandemic that has claimed more than 238,000 lives. And we all know that if the Affordable Care Act is struck down, communities of color would be hit particularly hard: Black, Asian, Hispanic, and Native American, because they are at a greater risk of pre-existing conditions, from asthma to diabetes to lupus. And they are also 3 times as likely to contract COVID-19 and twice as likely to die as others. Now, I know we all know that we just had an election in America, an election where health care was very much on the ballot. Our country had a clear choice in this election. Each and every vote for Joe Biden was a statement that health care in America should be a right and not a privilege. Each and every vote for Joe Biden was a vote to protect and expand the Affordable Care Act, not to tear it away in the midst of a global pandemic. And Joe Biden won the election decisively, with more votes than have ever been cast in American history. It amounts to 75 million voices and counting, calling on the Supreme Court to see this case for what it is: a blatant attempt to overturn the will of the people. And the President-elect and I cannot let that happen. And now it is my honor to introduce President-elect Joe Biden.
Thank you, Kamala. Good afternoon, everyone. This morning, as was stated, the United States Supreme Court heard oral arguments on the case of grave importance to the American people. This case represents the latest attempt by the far-right ideologues to do what they've been repeatedly failed to do for a long time. In the courts, in the Congress, in the court of public opinion, over the last decade, to eliminate the entirety of the Affordable Care Act. Twice already, the Supreme Court has upheld the landmark law, in 2012 and again in 2015. And the Congress, expressing the popular will of the American people on a bipartisan basis, has rejected numerous attempts, numerous efforts by President Trump to erase the law as well. Now, in the middle of a deadly pandemic that has infected more than 10 million Americans, nearly 1 in every 32 Americans, often with devastating consequences to their health. These ideologues are once again trying to strip health coverage away from the American people. The goal of the outgoing administration is clear from the brief they filed in the Supreme Court. It asserts, and I quote, "The entire ACA thus must fall," end of quote. Now, I'm not naive about the fact that health care is an issue that has divided Americans in the past. But the truth is, the American people are more united on this issue today than they are divided. Recently, as last month, a leading survey found that American people want to keep the Affordable Care Act in place by an overwhelming margin of 58% to 36%. 79% of the American people, including 9 out of 10 Democrats, 8 out of 10 independents, and 2/3 Republicans, want to keep the ACA protections for people with pre-existing conditions, which would be eliminated if this lawsuit were to succeed. This doesn't need to be a partisan issue. It's a human issue. It affects every single American family. We can't subvert the growing consensus of the American people based on an argument put forward in the briefs seeking to invalidate the law that even many conservative legal scholars, including in the National Review, consider to be, quote, ridiculous. Let's be absolutely clear about what's at stake. The consequences of the Trump administration's argument are not academic or an abstraction. For many Americans, they are a matter of life and death in a literal sense. This argument will determine whether health care coverage of more than 20 million Americans who acquired it under the Affordable Care Act will be ripped away in the middle of the nation's worst pandemic in a century. Over 100 million people, as the Vice President-elect pointed out, over 100 million people with pre-existing conditions like asthma, diabetes, cancer, could once again be denied coverage, whether complications from COVID-19 like lung scarring and heart damage will be the next flood of pre-existing conditions that can be used as an excuse to jack up premiums or deny coverage altogether. For millions of survivors who have struggled, won, and fought the coronavirus, fought against the loss of their life. This argument is going to determine whether women, as is pointed out, will once again be charged higher premiums just because they're women, or seniors will see their prescription drug costs go up. And like kids whether or not they can stay on their parents' plans till age 26, whether annual lifetime benefits will be reimposed. So someone could walk in and say, die in peace, you've run out of your coverage. This isn't hyperbole, it's real as it gets. When a family is faced with the awful news of a child's diagnosis with leukemia, or a mom forced to battle against breast cancer, an accident that leaves loved ones unable to live the life they've always known, it stops your heart. It stops your heart. It wrenches your entire world right off its axis when that happens. And many of you know that from your own personal experiences. Believe me, I know the feeling, and too many American families do as well. In that moment, the very last thing on your mind, the very last thing should be on your mind, is whether you can afford the treatment. The Affordable Care Act was created to put a stop to that inhumanity. It was created to ensure that families thrust into their worst nightmare of their lives could focus not on money, but on the fight that really matters. Obamacare is a law that every American should be proud of. It's why people with pre-existing conditions are protected in this country. It's a law that delivered vital coverage, as I said before, for 20 million Americans who did not have coverage. It's a law that reduced prescription drug price costs for nearly 12 million seniors. It's a law that saved lives and spared countless families from financial ruin. So this effort to bypass the will of the American people, the verdict of the courts in the past, the judgments of Congress, in my view, is simply cruel and needlessly divisive. Regardless of the outcome of this case, I promise you this: beginning on January 20th, the Vice President-elect Harris and I, we're going to do everything in our power to ease the burden of health care on you and your families. I promise you that. As I said, I will protect your health care like as with my own family. And we've been, unfortunately, significant consumers of health care. That starts by building on the Affordable Care Act, with the dramatic expansion of health care coverage and bold steps to lower health care costs. My transition team will soon be starting its work to flesh out the details so that we can hit the ground running, tackling costs, increasing access, lowering the price of prescription drugs. Families are reeling right now, particularly the reporters in this room and others listening. You've interviewed a lot of these people around the country as you've gone all over the world, all over the country. Enduring illnesses, faced with risky choices, losing their employer plans in droves. Already 10 million have already lost their employer plans. They need a lifeline, and they need it now. They should have to hold their breath. They shouldn't be in that position, waiting to see if the Supreme Court is going to wrench away the peace of mind they've come to now rely on? So we're going to get right to work, I promise you, addressing the issues that families are talking about around their kitchen tables this morning, making sure that they can get in bed tonight with the peace of mind that they deserve, and fulfilling our moral obligation to ensure that here in America, health care is a right for all, not a privilege for a few. So come January, we're going to work quickly with the Congress to dramatically ramp up health care protections, get Americans universal coverage, lower health care costs as soon as humanly possible. That's the promise I make to you. We're going to fight for your family's health coverage the same way we fight for our own family's health coverage. We want every single American to know, if you're sick, if you're struggling, if you're worried about how you're going to get going to get through the day, we will not abandon you. That is a promise. We'll not leave you to face these challenges alone. We're going to get through this. We're going to get through it together. And we're going to build a health care system that puts you and your families first and that every American can be proud of. I want to thank you all for listening. May God bless you. May God keep you safe in this COVID environment. And may God protect our troops.